Last week, President Donald Trump signed an executive order to lower U.S. drug costs. Trump says the goal is to slash prices by 30 to 80%, but some health policy experts say it's not that simple. Joining us now is Dr. Adjoa Smalls-Mantey, immunologist and physician. Welcome. Good to talk to you this morning.
Hello. Nice to speak with you, Mary.
So how does this executive order compare to previous efforts by U.S. administrations to lower prescription drug prices?
So this executive order is more wide sweeping, and they talk about really trying to enforce that as well, although the details are not clear about how that enforcement will happen. In the past, specific drugs have been targeted, but the attempt now is to look at all drug prices.
And why are drug prices so much higher in the U.S. compared to other developed countries?
In other countries, the governments do negotiate the prices of drugs, and that has happened previously with other administrations to negotiate the prices of just a couple of drugs. But in America, a lot of the drugs are prices are not negotiated.
And what makes it so hard to enforce a policy that ties U.S. drug prices to international ones?
One of the difficulties in enforcing the prices is what agency is going to pay. So for Medicare, where a lot of people are covered under a drug, the government does have a little bit of weight to say, hey, this is how much we are going to pay for these drugs that more of our patients are on. But when it comes to other drugs, what they can do, how they'll do that, it is not exactly clear.
Which drugs are most likely to be affected, and why does that matter for patients who rely on them?
So right now, the administration's policy is really broad sweeping. They haven't talked about specific drugs that they're targeting. In the past, drugs that target diabetes, heart disease, heart failure, a couple of cancers have been the focus. And so I would expect that first the administration would really try to focus on drugs that a lot of people are taking. And a lot of those issues are diabetes, are heart failures, are some immunological disorders.
If prices drop in the U.S., could we see drug makers try to raise prices abroad?
That could happen, and a lot of people are saying, hey, other countries need to pay their fair share. And it is very widely known that in America, we pay a lot more for our drugs. And the argument is that the pharmaceutical companies have to recoup their cost of development. But it is important that the costs be shared. And how much is this cost is a big question.
Well, Doctor, thank you so much. It's good to talk to you today. We appreciate you coming in and joining us.
Thank you.
For more information about Trump's executive order to reduce drug prices, visit cbsnewyork.com.